Hey guys, welcome back. We are talking about common childhood illnesses. So let's get started. The first one we're going to talk about is otitis media. This is inflammation of the inner ear, more commonly known as an ear infection. Super common in kiddos, and it's due to their eustachian tubes not being as long as adults. They grow as you get older, and so we often grow out of having ear infections. But these are often caused by different bacteria, infections, often respiratory infections that travel up and they get into our ears, and they have to be treated with antibiotics if it is due to bacteria. So very common if children have very frequent ear infections, they may discuss using tubes or having tubes put in their ears, and this sometimes helps with to decrease the frequency in the ear infections. Common cold, very frequent in children. This is just caused by a virus, right? It spreads through droplets in the air. A lot of times it's just going to consist of runny nose, coughing, sneezing. You may have like a slight fever with it. And here, because it is a virus, antibiotics will not help. It just have to let it run its course, right? Viruses, we just let it go. And you're going to just want to rest, keep up our fluids, and continue on with a good diet. Tonsillitis. This is most often caused by strep, so group A hemolytic strep, streptococcus, and it's a virus. Or a virus, so it's either strep or the virus, and it can cause, you can also have fever, cough, sore throat, and those tonsils will be inflamed. So itis on the end of a word means inflammation, so here the tonsils are inflamed. If it's due to a bacterial disease like strep, you're going to give antibiotics. If it's not, you would let it run its course, but you would learn if it's strep or not by doing a culture insensitivity or a strep swab on those tonsils. The next one is going to be pediculosis. This is another word for lice. Lice is common in kids, especially school-age children. They're in close contact with one another. They're highly contagious, and anything in their environment needs to be clean. So stuffed animals, sheets, bedding, backpacks, clothes, everything has to be rid of lice to decrease their spread. And this is diagnosed on just visual exam. You'll be able to see the lice on the scalp of the child. All right, asthma, also very common in children. Some children do outgrow childhood asthma. The cause is really unknown, but it can be triggered by different environmental substances. And what happens in asthma is the bronchi actually start spasming, decreasing the amount of oxygen you can get in and out of your lungs. And so you may, for those having asthma, maybe given an inhaler to help open up and smooth out that airway. Again, if it's environmental, you'll want to figure out what the triggers are, which environmental triggers cause the asthma attack. Sometimes it's pollen or mold or grass. Smoke can be even a trigger, and so we'll need to be giving them medications to help open up their airway and control that asthma. Croup is often it's kind of after effects of a common cold, and here they're gonna have a really barky cough, and I'm sure you've heard a child cough like that, but it almost sounds like a bark as they're coughing, and they may even have some like stridor, which is a high-pitched noise made when they're breathing, and they can even have respiratory distress with it. A lot of times it gets worse at night and they have more trouble breathing at bedtime, and they may need emergency treatment for this if it gets bad enough. You can also help treat or help control the symptoms of croup by putting the child in a bathroom and running warm water, and this warm steam helps open up the airways. Also, the cool mist from inhalation can help if you have some kind of mist or dehumidifier thing. The next is pertussis, or whooping cough. This is highly contagious respiratory infection. There is a vaccine for whooping cough. It can be very serious in infants. So those children born around flu season, they'll make sure that mom has this vaccination, but it's really important for others that are going to be in contact with this newborn to have the whooping cough shot. They also give it to college age students because there are often outbreaks of whooping cough in these dormitories and things where people are in close contact with one another. All right, moving on to respiratory syncytial virus. You may not have known that you have heard about this one, but this one is also known as RSV, which is common here. Lots of our kiddos at Le Bonheur in the wintertime are diagnosed with RSV. It affects the lungs, and it's the most common cause for pneumonia in kids. It's a virus, and it spreads very easily and rapidly. Moving right along to fifth disease. This is a viral infection among school-age children, and you may also hear it called the slap cheek disease or slap cheek syndrome, because they'll have big, bright red rashes on the cheeks. They may have a low-grade fever, a sore throat, headache, and joint pain. So they're going to treat this with anti-inflammatory medications to treat that fever and that joint pain. The next one, hand, foot, and mouth. I have personal experience with this one. It's a viral illness for children under 5 most commonly, and it's spread through fluid and from blisters and through saliva. So this often occurs to those younger ones because they don't know not to put their mouth on toys, and then the other kid puts the toy in their mouth, right? And then my son actually had this. We had no idea what was going on. All of a sudden he stopped eating, he wouldn't take his bottles, and he actually had hand, foot, and mouth all down his throat, making him not want to eat because it hurt. So here they're going to have red, like blister-like sores on their hands, their feet, and around their mouths. For my son, he never developed the blisters on his hands, feet, or on the outside of his mouth. He only had it in his throat. So just remember that patients do present differently sometimes, but generally they will have those sores and then also have a fever and poor appetite. And it takes 7 to 10 days, and you just let it run its course. So unfortunately he was pretty miserable for a while, but then we were able to give him some Tylenol, some ibuprofen, help with his fever, and he was able to eat and he was okay. All right, scarlet fever. This is caused by a group A streptococcal infection. It causes a scarlet colored rash, hence why it's called scarlet fever. They have this rash on their neck, under their arms, or even in the groin area. It's usually not severe, but it has to be treated with antibiotics because later in life it can spread to the heart and cause issues. So it's important to take care of that group A strep infection with antibiotics. And then lastly is conjunctivitis. You might not know that you know this one either, but this one is pink eye. So it is an infection of the conjunctiva, and it's caused by bacteria or viruses or any other type of irritant. A lot of times it is bacteria, especially when it's found in children. And in that case, you would need antibiotic eye drops. A lot of times this is from poor hand hygiene, so perhaps they're potty training, they're learning how to wipe, and then they touch their eyes, or whatever type of bacteria they are, being around, and then they put it in their eyes, causing that bacterial infection. So again, if it's bacterial, you'll need antibiotics. If it's not, viruses, and they'll just run their course. So these are some of the most common childhood illnesses. I want you to check out the Kahoot game that I'm going to link to and see if you can identify some of these illnesses just by looking at pictures.